Dr. Tan has said, Barrett's is something that we have to keep a follow-up on, because Barrett's actually is almost like a precancerous condition. So in patients who have a lot of reflux disease, which typically happens if they drink a lot, take a lot of fatty meals, have poor digestion, and sometimes they have this hiatus hernia, it predisposes to reflux. Then the esophagus gets exposed to the acid that's formed in the stomach and undergoes the changes that Dr. Tan was talking about. And that definitely predisposes to cancer. So a patient with Barrett's will have to remain on lifelong follow-up to try to ensure that if any cancer develops, it is picked up early, and that the appropriate surgery should be done as soon as possible.
Oke, jadi ini adalah pertanyaan selanjutnya, adalah Barrett syndrome itu apakah menyebabkan kanker? Dijawab ya oleh Profesor Melissa Theo. Jadi Barrett ini sebenarnya adalah kondisi kita sebelum kena kanker sebenarnya. Jadi kalau kita perhatikan sebenarnya kalau kita ada Barrett itu harus hati-hati. Karena jangka panjangnya kita harus melakukan monitor secara dekat ya. Jadi Barrett ini memang harus diamati dan diambil sampelnya setiap waktu. Kita harus tahu persis apakah kanker ini akan timbul dari kondisi Barrett kita.
I guess it is very difficult to say what the diarrhea is due to. I think that food poisoning happens, and food poisoning usually happens in a group. So if you have a bunch of people who have gone to a restaurant, or everybody in the family is having the same symptoms of diarrhea because they ate the same dinner, then yes, probably food poisoning. But if everybody has gone to the same restaurant and the person is only one person is sick, then it may not necessarily be food poisoning, but it could still be infective colitis. Infective colitis still means that the person has an infection in the colon, and that could cause the bad diarrhea. I think the important thing is also how severe is this diarrhea, how many days it lasts for, and how often is this person getting diarrhea. Everybody gets, on-off stomachache, on-off diarrhea, sometimes, vomiting and all that. But if it happens once in many years, we are not worried. But if you have somebody who is having diarrhea, and this diarrhea keeps on going on, so we call a change in bowel habit. We used to pass motion one time a day, very nice stool, and now recently the stool has been getting softer and mushier, and it becomes very small, and it's consistently in this phase, and for weeks no change, and the person is losing weight and all that, then I think definitely the person needs to seek medical attention.
I see. Oke, jadi ada pertanyaan, ada seorang yang mendapatkan diare ya dari Senin kemarin sampai hari ini. Apakah ini kondisi sebut keracunan makanan? Dijawab oleh Prof. Melissa bahwa sebenarnya itu susah untuk menjelaskan tentang diare ini karena sebabnya bisa banyak sekali. Patokannya simpel, ketika kita makan di suatu tempat atau restoran, apakah kita satu restoran itu sakit perut semua atau teman-teman kita atau saudara kita sakit perut? Kalau hanya kita, kemungkinan besar bukan karena keracunan makanan. Kalau keracunan makanan itu biasanya semua pasti kena. Nah, kalau kita sendiri, ya kita harus ngecek ke dokter. Itu nomor satu. Nomor dua adalah yang harus kita perhatikan adalah mungkin berapa sering kita ke toilet ya. Kalau sering sekali kita ke toilet dan bagaimana kondisi kotoran kita. Ya kotoran kita tuh apakah semakin berair atau berdarah atau macam-macam enggak, itu baru penting kita harus segera ke dokter. Dan yang ketiga adalah berapa lama kita mengalami ini. Kalau sudah berminggu-minggu dan terus lama sekali, ya berarti kita ada perubahan dari bowel habit kita, ada perubahan dari cara buang air kita. Nah, itu penting sekali kita harus segera ke dokter dan mengeceknya.
Okay, so you don't Nexium for a long time. I mean, firstly, we don't normally prescribe it for a very long time. Definitely not for 5 years. And the reason is because Nexium is usually used for specific conditions. And if the person is not responding well to the condition, even with the Nexium being on for a while, then maybe Nexium is not the correct treatment. Maybe something else more permanent needs to be done. So it's dangerous also because I guess I have patients, or rather not patients, or patients that I've heard of who have gotten a scope done and it is found that they have gastritis or they have some reflux and so on and so forth. And they are prescribed Nexium or omeprazole, Losec by the doctors. And sometimes some of these patients have even a gastric ulcer. a stomach ulcer. So then the doctor gives them the treatment and tells them, you know, okay, in 6 weeks' time, 2 months' time, we need to scope to make sure that the ulcer has healed. But the patient doesn't want to have the repeat scope. So the patient goes to another doctor and says, I did scope already, I have ulcer, can you give me Nexium or Omeprazole? And then they take the medicine and they say, yeah, I feel better, but I think I need some more. Then they get another prescription. And after the second or third prescription, the doctor says, I think you better do another scope. And the patient says, I don't want. So he goes to look for the third doctor. So every 3 or 4 months, the patient changes doctor. And so it's on the Nexium or the Omeprazole for a long time. But if this ulcer is not healing, then the worry is that this ulcer has got cancer cells inside. And that is the reason why doctors say, if you take the medicine and you cannot live without the medicine. The moment you stop, you have problem, then we need to have another look to find out really why is it not healing. Okay, so long-term medication generally is not good. And there's always a reason or something that is wrong underlying that needs to be taken care of, not just with long-term treatment of any medication.
Okay, very good. Oke, jadi ini ada pertanyaan, mengkonsumsi Nexium 40 mg selama jangka panjang atau 5 tahun apa berbahaya? Depannya gimana? Prof. Melisa menjelaskan bahwa sebenarnya obat-obatan seperti Nexium itu kita harus konsumsi tidak dalam waktu terlalu panjang ya. Jadi kalau memang obat itu dikasih dan tidak menimbulkan efek yang baik, mungkin obatnya harus diganti atau ada penyakit lain yang harus kita perhatikan. Ya, Prof. Melisa menjelaskan bahwa ada satu pasien ya yang beliau kenal melakukan endoskopi, dan ketika melakukan endoskopi ditemukan sebenarnya itu ada ulcer di situ ya. Jadi ketika ditemukan ulcer diberikan Nexium dulu, akan dilihat apakah Nexium ini bekerja, ulcernya sangat berkurang, dan dilakukan kira 2 bulan lah, 2 bulan kemudian untuk cek kembali untuk dilakukan endoskopi. Tapi pasien ini nggak mau endoskopi, memilih untuk ketemu dengan dokter yang lain. Dan ketika ketemu dokter lain pasti langsung dikasih Nexium lagi. Ya, habis Nexium dibilangin nanti kalau Nexiumnya ada mau habis, kita coba kontrol, kita endoskopi. Dan pasien ini nggak mau di endoskopi lagi, ketemu dokter yang ketiga dan kasih Nexium lagi. Jadi mengkonsumsi Nexium selama waktu panjang ini, dan Nexium ini kalau nggak diminum perutnya sakit lagi. Jadi kita harus perhatikan sebenarnya sebabnya itu apa sih. Kalau memang kita minum obat, oke, nggak minum obat terus nggak oke, kita harus cek lagi sebenarnya itu apakah ada sakit lain yang kita nggak tahu. Jadi memang sebaiknya kalau minum obat jangka waktu yang panjang, kita harus cek lagi apakah efektif, apakah tidak. Ya.
There are a couple of common conditions, and when you say cyst is a very generic term because cyst can mean a lot of things. I think what the person means to say is usually you refer to tumor, and the tumor can be cancerous or non-cancerous. So patients can have polyps in the stomach, and polyps in the stomach are quite common, and most of the time the doctor will explain to the patient and say you have some cyst in the stomach. Actually, it's not cyst, it's polyp. But the polyp in stomach usually is not dangerous like polyp in the colon. Polyp in the colon, like what Dr. Tan has explained, needs to be removed because polyp in the colon can change, has a higher chance of changing to cancer. Polyps in the stomach most of the time will remain the same size for many years. And yeah, every now and then you can put a scope in to have a look. And when I do a scope and I see some polyps, I usually biopsy the biggest one to test to make sure that there's no cancer, because you were asking me, how do you know if it is cancer or no cancer. And so we will biopsy the biggest one. And generally speaking, if the biggest one is negative, the rest are okay. There is another condition known as GIST, not cyst, but GIST, gastrointestinal stromal tumor, GIST. That is a tumor usually in the stomach, and interestingly, it is not inside the stomach, but it is usually in the wall of the stomach, and sometimes it comes out. When we do a scope, we may not see a tumor. Sometimes we will see just a very interesting ulcer. We call it umbilicated, but that is a medical term. All right, when we see that, we are very suspicious. Or sometimes we do not see a tumor in the stomach, but we see that there is a bulge. There is a little hump in the stomach, and we suspect that maybe the tumor is in the wall of the stomach and on the outside. So in patients where we have this suspicion, we will ask the patient to go for a CT scan. And the CT scan will be able to show us the tumor that is in the wall and on the outside of the stomach, even if it cannot be seen on the scope.
Oke, jadi sobat saya rangkum ya, pertanyaan yang bagus sekali. Apakah kista perut itu berbahaya dan bedanya apa dengan tumor? Dijawab oleh Prof. Melissa, sebenarnya kata-kata kista itu kalau di perut tidak ada, adanya adalah polip. Ya, jadi kebanyakan mungkin yang dimaksud adalah polip. Berarti polip ini beda dengan polip yang ada di usus. Polip perut itu biasanya tidak berbahaya. Kalau di usus pasti akan menjadi kanker. Kalau polip di perut biasanya ya nggak apa-apa dan ukurannya sekian aja. Dan ini biasanya bertambah banyak dengan berjalannya waktu. Nah, kalau kita ditanya apakah polip ini berbahaya atau tidak, Prof. Melissa menjelaskan bahwa biasanya cara dia simpel sekali, kita masukkan endoskopi, kita ambil sampling dari polip yang paling besar ukurannya. Dan biasanya kalau ukuran yang paling besar itu negatif, yang lain biasanya nggak apa-apa. Seperti itu. Ada jenis lain yang dijelaskan oleh Prof. Melissa, yang jenisnya namanya GIST, ya, GIST, itu adalah sejenis tumor jinak yang kalau berkembang itu ke dalam, bukan keluar dari dinding perutnya, nanti keluar dinding perut. Nanti di dalam biasanya ada perubahan warna atau seperti ulcer, seperti itu. Jadi ketika dokter melihat itu biasanya akan dilakukan cek lebih lanjutan lagi. Dan kadang-kadang ada beberapa kondisi yang ada lam, jadi ada seperti benjolan besar di dinding kita. Kalau itu terjadi, biasanya Prof. Melissa akan melakukan namanya CT scan, akan memastikan bahwa benjolan itu tidak berbahaya. Seperti itu.
So bloating is a very common thing, and I don't think that people get cancer just from being very bloated. And the first thing I would do is to check what kind of diet the patient is on. I had a patient who saw me the other day and says that they are very bloated, and we scoped, and the scope didn't show any problems. But later, when we were talking about what she ate at home, she loves to eat garlic, she loves to eat onions, she loves to eat spring onions. And she said every meal she eat one bowl of garlic. So I say you stop eating the garlic for a while and you come and tell me if you are better. And 1 week later she said no more bloating. So the diet is important. If you eat a lot of beans, green beans, kidney beans, red beans, you eat a lot of lentils, you eat a lot of cabbage, cauliflower, onions, spring onions, garlic, you can be bloated for a long time. The second possibility is also gallstones. People with gallstones can be bloated, especially after eating very oily meals. So if the scope doesn't show anything terrible, no gastritis, no problems in the stomach and colon, I would do an ultrasound of the gallbladder to see if there's any gallstones. Because if they have gallstones and they always get bloatedness after eating oily food, then the surgery that they will require is a removal of the gallbladder. So these are the common things. Of course, there will be patients who have what we call irritable bowel syndrome, and they are very sensitive to different types of food, and certain foods will cause a lot of bloating, and they will tell you that they are bloating for many years. I will tell these people to keep a food diary. Every day they write what they eat and they write whether they have bloating after that. Then they will, over the next 2 months, be able to identify food that doesn't cause them bloating and food that does cause them bloating, and they will avoid all these foods that cause them problems, and then we will observe. Sometimes we can give medication to relieve the bloatedness, but of course it is always important that we exclude serious conditions before we just say, you know, it's just bloating for no reason. But my suggestion is that if you have patients with this kind of symptoms and they cannot find an answer, then better fly down to Singapore and look for Dr. Tan or myself, because whether it is scopes that they need or gallbladder problem that they have, or unfortunately some of them will have cancer, we will deal with all of them.
Oke, jadi ada pertanyaan, pasien sering kembung-kembung dan sering buang angin, apakah ini berbahaya dan kedepannya akan menjadi kanker? Prof. Melisa Teo menjelaskan bahwa kembung-kembung banyak angin itu biasa, jadi itu bukan hal yang berbahaya dan kedepannya juga nggak apa-apa. Dan sebabnya yang nomor satu itu adalah cara makan kita atau diet kita, pola makan kita itu bagaimana. Prof. Melisa Teo menjelaskan ada seorang pasien yang temui Prof. Melisa mengaku perutnya sering kembung-kembung dan dilakukan endoskopi dan hasilnya baik, ada apa-apa dan ada sesuatu yang membahayakan. Dan Prof. Melisa tanya gitu, kamu tuh sering makan apa sih? Hobimu tuh makan apa? Ya beliau menjelaskan bahwa sering makan bawang bombay ya, di spring onion yang bawang yang besar, dan katanya setiap makanan pasti makan satu yang ukurannya paling besar katanya gitu ya. Pasti aja perutnya langsung kembung-kembung gitu. Dan juga kita harus perhatikan juga makan makanan lain yang sering membuat kembung seperti misalnya daun kol, ya kacang-kacangan. Jadi kalau memang kita perutnya sering kembung, ya kita kurangi untuk makanan-makanan yang membuat perut kembung. Yang kedua, Dr. Melisa menjelaskan kalau bukan yang itu, yang kedua yang Prof. Melisa jelaskan adalah melakukan USG, ultrasound, untuk mengecek apakah perutnya itu ada batu empedu. Ya, karena biasanya kalau ada kondisi seperti itu, batu empedunya mungkin ada iritasi atau ada harus yang dioperasi. Jadi pastikan aja batu empedunya nggak apa-apa, Dan yang ketiga juga memang harus ada beberapa pasien yang mengalami namanya IBS atau Irritable Bowel Syndrome. Jadi Prof. Melisa menyarankan pasien ini untuk melakukan namanya food diary. Jadi seperti diary kecil, mencatat makanan-makanan apa yang kita makan tiap hari. Kalau makan ini kembung, catat ini kembung, makan itu nggak kembung, ya kita catat. Kita harus tahu makanan apa yang membuat kembung dan makanan apa yang nggak membuat kembung.
Terima kasih telah menonton video ini. Jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.